Well, I'm so excited today to have our featured panelists. So, one thing I've discovered in life is often we see the same problems and we come up with similar solutions. So, I've been at this for a while, and way back in 2017, we were working with community health workers, and I was a CEO of a federally qualified health center, and started working with schools, and they were talking about sort of these social determinants of health needs and how they impacted education. And so at that time, I put a community health worker in a school. And since then, our program here at Telehealth Rocks works very closely with that. I was at a meeting that Department for Children and Families had in Kansas City, and Stacey Tweedy was there talking about this amazing program that Department for Children and Families had established, first in the Emporia school districts and then in the Hutchinson district as well. And I was like, this is exactly what we do. It's so interesting that we do such similar work. And since then, I've become a very close partner with Department for Children and Families because so much of this work impacts that work. And so, Erica is the Family Support Specialist Liaison with this program in the Hutchinson School District. And since then, I've gotten to know her and talked with Hutchinson schools and see their strong commitment to keeping this program going because it's such an important part of what they do. But I don't have to talk about these people. They're going to talk about themselves. So let's go to the next slide and we'll talk through some questions. I did want to say as well, I hope people, as they have questions about anything we've talked about today, and especially as they have questions for our panelists, please speak up. We're happy to talk about those. If you don't ask questions, I will. So we're going to start as you think about your questions, and you can put them in the chat or just unmute to do them. So Stacey, I just wanted to hear from you a little bit about how community supporting families started in schools. Why did DCF start that or begin partnering with these school districts? And what were the needs that you saw from your perspective?
Good morning. Thanks, Robert, for having us. So this is my favorite thing to talk about. I could talk about this all day long, but I won't. So here we go. So how we got started was back at the end of 2020. So, we were all living through COVID. And on the national level, even there is this conversation about poverty versus neglect and how do we keep families who there are no concerns of abuse or neglect, but there are like states receive intakes about families. So there are worries. And in Kansas, we assign those as families in need of assessment cases. And so again, those are families where there's not worries of abuse or not worries of neglect, but there is usually services that families need. And so the conversation really was about how do we keep families from coming to the agency's knowledge, because, then it's like that's stressful for families if they don't need us because there's abuse or neglect there. So we started having this conversation about what that might look like. And we know that our education partners see kids like they're the everyday touch, right? They see children every day. And so how might we come up with a solution to have someone available to intervene at the very first moment that it looks like something has changed in the life of a child? Like, things are not normal, not how things are, how they normally come to school or whatever. And because we know once DCF gets involved, sometimes families aren't very cooperative, and they're not uncooperative because they're difficult, like they're scared. There's fear, like they've had past experiences, as a child or, as an adult with the agency. And so how could we, in some of those cases, have someone to intervene before the family ever came to our knowledge? And so we did lots of work. We were actually part of a National Governors Association. Kansas was one of the states that was selected. We worked a whole year on this project. Emporia School, Dr. Harder, the superintendent, actually was on our initial team. We got Emporia up and going in 2022. Worked all of 2021 on it. And then the second half of 22, Hutchinson schools also came on board. And really both districts have been fantastic. The specialists are wonderful. They work for the school districts. They do not work for DCF, but the agency has an interagency agreement with those districts that offset the cost. So it's a grant for a period of time.
So Stacey, can you, not Stacey, excuse me, Erica. I'll go, I always mess things up. Can you tell me a little bit, one of the things that was interesting, is you guys kind of saw this happening in Emporia and then you wanted in on that. And so I'm both curious about kind of why did you see the need for a program like this in your school district, but also can you tell us a little bit about being a family support advocate, which I think I just got that title wrong, but
You're
you
okay.
know,
Yeah. So I wasn't here when they decided that they wanted to do this, but I worked directly under the people who wanted to bring the program in. And they just saw kind of the same thing that, Stacey was saying, is that we have families who need support, they need resources, they need somebody that they can reach out to, and we need somebody that our teachers can communicate with for needs that are not abuse and neglect, so that we can kind of take care of ourselves, maybe like a holistic approach. So, thinking along those lines, that's why they really wanted to start the program. Now I'd say I don't have the exact numbers, and I maybe should have, but I would say at a minimum every month I'm working with at least 30 children. Some months like that all the way doubles. So it's really varies, but it's obviously very beneficial, very impactful. And it isn't just working like with their families. Like I said, it kind of came naturally, but really being a person for our educators to reach out and talk things through with, like, say, I have this student and I think this is a concern, but I don't know. Like, I don't know what I should do, who I should reach out to. So just kind of being there here in the school, somebody that everybody feels, comfortable and safe talking to, and then we can make decisions together if, it is a DCF report, or if it's like, let's just reach out to them and see what we can do. And I think that's been, a really big benefit for our school district.
so what are some examples or kind of what are the variety of things that you routinely work on with kids and families?
So, attendance, since I've been here, one of the things that has been a problem when I met with our local DCF and then all of our administrators, was truancy, and making sure we kind of came up with a consistent plan for truancy. So I helped them kind of create their plan, how they were going to pull that, and then how we were going to work with the families, hopefully before they had to go through truancy and get to the point of needing to have a court situation because of truancy for her attendance, but also resources, housing, food insecurity, sometimes behaviors at school, helping families navigate medical needs, mental health. But really, it's taking the time to meet with those families, know what the schools are saying, but hearing what the family really thinks and has as their concern, and walking with them to meet those concerns. Because what we see at school is only a portion of maybe what's going on in their home and what they really need, that support with.
So Stacey, I was curious, so why did DCF see that it was important to have this be a school district employee and be someone who, really represented the school district in this work?
Yeah, it's a great question. So we know that our education partners see children every day. Like sometimes they're the only other entity that sees a child outside of their home. And so it made the most sense that that's where this partnership would start. Also, families have lots of connections at school, and generally school is a safe place. Like families feel safe at school, children feel safe at school. And so it just seemed to make sense that that the intervention was at school. it just seemed like the right place to do it. I also want to add, Erica, I do know your number. Since the inception, since Erica started in August of 22, she has served over 1,200 students, which is phenomenal.
Oh, Pamela Thompson asked a question that we may have to tag team on, um, which was, how are these different than community health workers? And we've had conversations such, with Hutchinson and Emporia schools. And one of the things that is really important to me is no matter who the helper is, no matter who this person that takes on this role, in some districts are fortunate to have a school social worker. Other districts, the districts that we tend to work with have school-based community health workers. Um, Erica, I know that's kind of putting you on the spot because I know you don't work a lot with community health workers, but what do you think is specific about your approach, or the approach that Hutchinson is taking through this program?
You're right, I don't know as much about community health workers, but I would say for our program, like I said, I will meet with the family, and sometimes that initial meeting is an hour. Sometimes it's longer, sometimes it's shorter, but it's meeting with them and listening to them and really getting to know them. So it's on their time because this is obviously their life and I'm trying to help, and I don't ever want to just assume that I know about them. So it's really, listening to them and working with them. And then relying on, the school district to provide information to me that I might need, especially, they're the ones making the referrals, but it's really working with the family and walking alongside them in whatever they need.
And I think that's key to whoever it is, still social
Yeah.
work, but I don't care what you call it. I
Right.
am, we use a model, community health workers, because they, for us, it's a credential provider, we have our reasons, and also because that's just what I know. But I don't, I am more concerned and hope that schools can identify a resource that can help families with this. I don't really care, other than I hope they do, that they take an approach that works and that's family supportive and all the things we can talk about.
Right.
But there's no special sauce in community health workers or family support. It's just having someone there. The way I talk about it a lot, and not to go on about about my side of things, but is, I talk about in systems, often the family, the child doesn't have somebody on their side to talk about talk about how we're talking about things today. So it's just whoever that person is, the goal is to have someone that can help that family understand the system, can advocate for that family with the system, but also represent the system, whether it's the school or DCF or someone else, to talk about ways that they're doing things that make it hard. We ask, why don't families do this? Or why doesn't the student do this? Sometimes we have to ask, why are we doing it in this way that makes it hard for them to do it?
Yep. And I think it's also really important is I try to help the families that I work with learn how to navigate things. So we might only be working on getting to a pediatrician, but calling and making an appointment and getting your insurance card and filling out the paperwork and making sure you have all the documentation you need, it's the same system, and you can just transfer it to the next thing that they might need to work on or do without me. And so that's something that I think is really important, is making sure that the families that come and I work with have then a skill to help them later.
Before we move on to the community context, I know a comment came up about truancy. And so, Eric, I'm really interested because I know you said you work a lot with truancy issues. So tell me, like, what's important when you or work on this, or kind of how do you go about working on this, on these students and these families' needs?
So I think for us in Hutch Public Schools, the biggest thing we had to figure out first was administratively how we're going to make a process be consistent and early. So like detect the problem before it's 40 attendance concerns. Make sure we get into a family and talk with them when it's 2 or 3, that we're starting to see the pattern, and making sure that we're not just sending that letter. so that if we do send a letter, we've got, you know, the contact information of who they can reach out to, but we're also following that up with something in person, or a phone call, so that we are making a connection. A lot of the time, not every time, but a lot of the time, it's don't know, don't do any better. So if we can teach them soon, they will start changing their habits and attendance can improve, especially with our younger kids. When we get into our older kids and it's their choice, you know, to like skip class, that's something different. But especially with our younger students, it's really teaching the families the expectations early. Um, Sorry, I saw that question pop up. And then also working with them and helping them outline, you know, who their supports are. So if it's transportation that's a problem, you know, because we don't bus in Hutch Public Schools very rarely. So who can help transport, or who can be your backup person if, you know, you're sick and they need to get to school, or if your tire is flat. So just helping them kind of have that plan in place, because that's the other thing that they come as well. Things happen and we can't get to school, or we don't have a way to get to the doctor to get a doctor's note. So just making sure that, you know, you're preemptive and you're doing things before it's a problem, and just kind of outlining as many supports as possible.
And I wanted to reiterate something that Pamela said. One of the things I talk about truancy is a symptom, it's not the problem. So we have to understand, why is that child truant? It can be transportation, medical issues, taking care of family members, and it can be issues with school or behavioral needs as well. And we have to get at what is causing this, because truancy is just a symptom. It's not the problem. So I want to, before we kind of move into talking more about the school and community relationships, I was really curious from both of your perspectives, you know, why did you see the need to have this kind of school-based support or earlier support for students and families? And I'll start with Stacey. Like, so what was DCF's goal in doing this?
Our goal really was to reduce the families coming to DCF's knowledge when there was not abuse or neglect reason for them to do so. Knowing that we can be kind of scary feeling when we show up at someone's door. And many times in those cases that are assigned as those families in need of assessment, when our staff were getting those cases, they were simply referring a family to local services that were already there in the community. And so it just makes sense. Communities and families are their own experts. Like, families know what they need, and our communities know what services are available. Like Erica in Hutchinson, like if you needed something in Hutchinson, Erica could tell you where that is, how to access it, what do you need to go with it. And so it just feels less intrusive to families and less traumatic if we can not be involved as a state agency when we're not needed. So if the families can directly, if Erica can directly give that family the name of that resource and how to connect, and even do a soft handoff, you know, calling, saying, hey, you know, Miss Smith's on her way there. Like, that just seems like the right thing to do for families and for kiddos, right? I hope Erica gets to share some of her success stories, because she has
Yeah.
some very sweet
Erica,
ones.
tell us a few examples where you really feel like this made a difference for a family.
Goodness. Okay. Well, this year I had, I mean, I have multiple for many years. I don't think, Stacey, you've heard this one. This year I have a student who is very medically fragile. English is not their first language and they're new to the United States. So adding all of that together, the school saw all of these concerns, but didn't know who or what, or even what they should do. So they reached out to me. My idea was to just get everybody into a room together and have a conversation, get a translator. So mom, you know, was hearing this in her language, and we were all just talking together. From that meeting, we got the student into a better fit classroom, a a schedule that gets her time with some other students about her age that also speak her language. So hopefully she can have some of that communication. Then we found ways to help afford some of the medical costs. She has to see a neurologist, and it's mostly out of pocket. So, getting some of that taken care of. I went with them to appointments because there wasn't a strong translator available at the medical appointment. And so I met with them and a translator prior. So, I knew some of those concerns and I could speak English. And then that translator was able to translate some of the basics to mom. She also ended up having to be in the hospital this year in Wichita. So helping them figure out how they were going to afford transportation because that means mom's not at work. So really this is just one case, obviously, but just being there and available for a family in probably one of the hardest situations they've ever had to face, somewhere new, somewhere different, and whatever they needed. And now, I've got a really great relationship with the mom, and the little girl just loves whenever I come see her at school. So just kind of, keeping that and making them feel safe and know that they had somebody, and making that connection with them within our community, within our school district, and that's just one of them. Like,
Before we kind of get to sort of some of the final, well, what makes a partnership work, I did hear you say something earlier that I think I understood. And if I misunderstood, Erica, let me know. But one of the things you mentioned was the family identifying the issue that's important.
yeah,
And so yeah, so tell me a little bit about that, because that's something I agree with. I talk a
yeah,
lot with RCHWs about, you may think this is the family's problem, but if
right.
they say that's the problem, then you help them with that. And is that about building trust, or why do you think that's important?
So I think that it's important for a lot of reasons. Building trust, yes, is one of them. But if I'm going to work with a family, I want that family to work with me. I want them to be just as gung ho and ready to get things taken care of for them. And if I'm telling them what they need or what I think or what the school thinks they need to do, it's less likely that they're going to buy into that. And I don't want to spend a whole bunch of time focusing on something that really isn't as much of a concern to them, because everybody has different ideas on what is, acceptable, different cultures, different, just what they're used to. So it might not be something that is a big problem to them. However, there's another aspect to their life that they really could use support with, that they really could benefit from having somebody work with them. And so that's why, yes, I take into consideration what the schools say and try to, pop that into the conversation whenever possible, but really listening to them and building that relationship with them and then moving forward on what they think is important in their life. Um, that's why I think it's necessary.
I appreciate that. So we have a few minutes left, and we haven't gotten to the big thing, which is, or one of the big things. Everything we've talked about is big. But when you talk about this partnership between actually a state agency, a community organization, the regional office, and the school district, what do you think is important about the partnership? But also, kind of what were the challenges? Stacey, let's start with you, since you were there kind of at the beginning.
Yeah, so I'll talk about the challenge, and then Eric, if you want to talk about the partnership with the local office, that would be great. So in the beginning, when we were working with Emporia School District, I will simply just be honest and say the challenge was when we Dr. Harder and I had worked on this team for a year together. And so when we were moving towards, hey, let's look at this, let's look at a position, and us doing an interagency agreement with it, I think it might have to her felt like too good to be true. So we don't ask for data. The only piece of data that we ask for is the number of families or students that each of the specialists serve each month, but we don't ask for names. We don't ask for anything else. Occasionally when I'm going to speak about it, if Erica or Sarah can join me like today, they do. Otherwise, sometimes I'll say, hey, can you share a couple of success stories with me? And they both do. Generically, I don't get any names of families. I don't get any other details. And really the interagency agreement was for them to do true prevention work, for them to really, be that intervention for families and to build those relationships. And it all is about relationships and community, right? And that's it. Like, we wanted to see a reduction in those FINA intakes, but really the goal was for them to do true prevention work. And so just in the beginning, that challenge was like having everyone understand, like, there really is no strings attached. Like, we really want to do true prevention. And then just trying to figure out, okay, what that looks like. So, who does the person work for? And we knew we didn't want a DCF employee. We knew we wanted it to be a school district employee. And so we helped give direction or like guidance on maybe what a position description might look like. But the districts made made it to fit their own desires. And each position description for those two districts who have it look different. And we meet with them a couple of times a year just to see how things are going and if they need anything. Those grants are coming to an end. Emporia has decided they're going to use some of their at-risk funds. So if you're in a district and you're on this, you're wondering like how's someone going to cover that. Emporia is going to use their at-risk funds to help continue the program. So it will be ongoing. And Hutch, I think, is still looking on how they're going to continue that. So yeah, that was kind of our challenge.
So Erica, in about 1 minute, because unfortunately we have to finish up.
Yeah.
What do you think is important?
So I think it's important. I meet with our DCF, so we have quarterly meetings, but also they communicate with me. The supervisors have made sure that I'm sorry, I blanked on what they're called. The workers know that my position is available. So when they have a family who's within the district, I'm able to join if they think it's necessary or if they need help and supporting this family, they're able to reach out to me. Like Stacey mentioned, I know a ton about Reno County. So I've even had some of their workers say, what can we offer to your families or what can we offer to this specific person? And I'm able to help provide some of that information. So just having a good relationship with DCF has also been, very helpful.